Hey guys, welcome to the Unleash podcast brought to you by Hidden Gene, where we talk about how to unleash your hidden potential. I'm your host, Yuri Origins, and we have a great episode for you today, feature J Patel. Thank you, Jay, for being here today.
Yes, how you guys doing?
Thank you very much for being here. It's a pleasure. So before we jump into today's topics, we would like to invite you to subscribe to this podcast on YouTube, Apple Podcasts, or Spotify. Also, you can always find this podcast on the Hidden Gene homepage, which is hiddengene.net. And if you live in the area and you have not been at Hidden Gene, you can always grab a free trial pass there on the website, again, hiddengene.net. All right, so talking about health, we have Jay Patel here. Uh, for those of our listeners that do not know about you, can you give us a little bit of your background, history?
Hello guys. My name is J Patel. I'm a PA with MyFitMed. I do a lot of hormone replacement, vitamin therapy, weight loss, and overall health. I'm a pharmacist and I'm also a functional medicine PA. So I specialize in health and wellness, and that's what I see every day. All my patients for health and wellness, they are overall healthy, but they want to take it to the next level. Right?
Okay. That's a good segue for the first question. So, based on your experience, you've been doing this. What is usually some of the most common side effects that people that visit your facility they complain about?
So the most common, if it's one thing, it's fatigue. Most of the patients that come in, either if they come in for fat gain, like gaining a lot of fat, losing a lot of muscle, uh, not feeling overall good, the bottom line comes out to be fatigue. I have seen so many patients that work out a lot, couple hours a day, or even 1 hour every day, 5 days a week, and they still can't see the results because what happens is they have some underlying issue. Their hormones are off, the vitamins are off, and if this thing is not addressed, then they don't see the results.
Mm-hmm.
And the most common thing that I have seen, especially young healthy people, um, they may have some as common as some vitamin deficiency and sometimes thyroid, testosterone, stuff like that. If that's off, they won't see their full potential in the gym and at work or anywhere. So most common symptoms, I would say, it's fatigue. That later down the road causes muscle loss, fat gain type of issues.
And this is common for male and female, right?
Male and female, yes. So this is the other thing. Lot of patients don't know that uh, even female has testosterone. They need testosterone. After certain age, the level starts going down, um, and they have to. It has to be at least optimized and checked
Mm-hmm.
and kept at normal level for them to feel their best.
Makes sense. Now there is because you mentioned young folks, so even you have also people that are young but they still have this fatigue. I will assume that it's not lack of testosterone at that point, right? It's more like on the vitamin side.
Yes, so that's the reason whenever the patient come in at our clinic, even if it's for weight loss, for fatigue, whatever symptoms they have, try to do their detailed labs because for younger people, it's not just testosterone, or it may not even be testosterone.
Mm-hmm.
Some of the other common stuff is thyroid, vitamin D. If their blood pressure, cholesterol, all those stuff is off, they won't feel their very best.
Okay.
Younger patient, I see stress is the other thing. They're not sleeping good. They're not following proper diet and exercise. Sometimes it's very minor issue that can cause a lot of other issues. The fix is very simple, but we have to find out what's causing it.
So, in order for you to get started with this diagnose, you basically order a full blood test. And what are you looking in this blood test? What are some of the patterns that you are looking at?
So if it's a little bit older patient, I also check the testosterone and everything, but mostly in general, I'll check thyroid, their liver, their kidney, cholesterol, um, vitamins, vitamin B12. If they have some other inflammatory issue, we'll check the full inflammatory panel. For older folks, we check some cardiac panel to make sure that heart is healthy enough.
Hmm.
So it's a little bit tailored towards individual patients. The other issue that I've seen with younger patients is they don't see doctor regularly because they don't have any major issue. So a lot of this minor stuff are really ignored. A lot of time I have seen patient that comes in for weight loss. When I ask them when was the last time you saw a doctor for any type of like annual physical or to get any type of lab done, and most of the time my answer is never.
Yeah. Now that's normal because usually you only gonna, at least on the overall mindset of people, they will only approach to find medical health if they are feeling something, right? Yeah, and the young folks, they mostly do not feel anything severe that lead them to do. But as far as physical performance at the gym, for example, that's one way to look at it. How can you go to this next level? Do you have some standard protocol? It will vary according to each individual.
So if the individual has no other medical issue, if we do the lab, everything is good. We also do IV therapy. We do amino acids, IV therapy, L-carnitine. All those stuff are very important for muscle building. And when we give it IV, it's 100% absorption. There is no GI issue cause like if they have GI issue that's causing the absorption, all those barriers are gone. So it's 100% absorption uh, for this young healthy people. This helped them in the gym and for overall health.
So the IV treatment is something that when you do is once a month, or what is the cadence for that?
So we have multiple different type, but once to twice a month is good enough for somebody who is overall healthy, right? Because what I we do personally is we give them different IV every time they come in. So like say this time if they had amino acid IV, next time we give them a depending on their goal. If their weight loss is the goal, then they get high dose of L-carnitine. All the IV overall also includes magnesium, zinc, amino acid, vitamin B complex, and some other minerals like copper, zinc, calcium. So all those stuff is important for heart health, for overall wellness, even for younger patients that helps them stimulate natural testosterone.
How long does you usually takes that IV treatment?
IV treatment usually about 20 minutes.
And there is any side effect or anything that should expect, or not really?
Wise, it's the injection, right? So chances of infection increases. If you are allergic to any of the medication, you may have allergic reaction.
Hmm. But
Certain patient, if they have some health issue, there is limitation on who can do it. But most of the time, almost everybody can do it. If you have any heart issue, if you have any kidney issue, like if you're older patient and if you have some heart issue, kidney issue, or if you have some type of contraindication, we'll evaluate you before even starting the IV.
yeah, yeah, because the first thing you do is to look at the blood panel anyway, so you will know the condition if that is applicable to that person or not, right?
Yes, and the other most important IV that a lot of your listener um, will like is the detox IV that we do. I give them high dose of glutathione, so that helps them clean up their liver. Because I have seen over time that when younger patient comes in for workout to improve their performance in gym, they usually take a lot of
Hmm.
supplements, and supplements put pressure on the liver. So we try to help them. It's not a cure for that, but it does help with it. And it's high, glutathione is one of the strongest antioxidant. It helps clean up the liver a little bit.
Yeah, interesting, very interesting. Does it vary the type of approach that you use for overall wellness versus weight loss versus muscle gain? Because sometimes you probably have people on this category that will say, I want to lose weight and gain
gain muscle.
muscle, right?
Yes. Yeah. So even that, like I try to take, I don't give cookie cutter to everybody because, like, say somebody who is 20-year-old comes in or 25-year-old comes in for weight loss and muscle gain, their approach will be a little bit different than somebody who's 45 to 50.
Yeah.
Right? Because 25-year-old will not or should not have testosterone issue. Most of then I take different approach. We still do the labs and make sure everything is okay, just the basic stuff is okay, and then uh, for those patients I tailor more towards healthy lifestyle, IV therapy, vitamins, and if something else is off, we'll fix that. For older patients we try to do hormones, um, testosterone the most important one, and we also do HGH therapy. So HGH peptide is something that helps with fat loss and muscle gain, and HGH peptide is healthier version instead of doing a straight up HGH because you have very limited side effect compared to doing like regular HGH. And HGH we have seen over time, it does help you metabolize your fat and helps you with a lean muscle mass. And most of the time there is very limited contraindication for HGH. So we use that a lot too. Especially if you want to do both, like you said, somebody who comes in, I want to lose fat and gain muscle.
Is that IGF-1?
So IGF-1 is one of the HGH peptide, but there's like samorelin, ipamorelin. We use combination samorelin with glycine. IGF-1 is one of the peptide. But HGH peptide is a general term. Yeah, there's a lot of different type of fragments that fall under it.
Yep. Yep.
And that also improves not only, it's not just for muscle gain and fat loss, but it also improves your sleep, improves your overall wellness, your digestion, almost overall everything it improves. So it's not like treating one thing, but it's for general wellness too.
Yeah, it's a general package, and I'm pretty sure that on top of that, you will give guidelines, or if not, not saying that you are a nutritionist, but you will also say you also have to have a balanced diet, because if you do all that, but you are eating crap, it doesn't really help.
Yeah, that's the reason I like when somebody who has all working out in gym and then come see me, it makes our life a little bit easier where I don't have to force them to go to gym, right?
Yeah.
If the other way, they come to me first, and if I have to force them to go to gym, it's a little bit difficult.
Well, but going to the gym usually is the easiest part, right? Sometimes people go to the gym, but they still don't eat very well.
Yes, yes. But at least the first part is the difficult part. Going to the gym is the
Okay.
part is I guide them, and when they start seeing results. So this is the other thing, when they are working out and when we optimize their health, they actually see the result. They think that, okay, this is achievable, right? I have seen so many patients from Hidden Gym. Then when they see a lot of people working out in really good shape, they want to be there, but after like 15 days, 20 days, they are like, yeah, I don't see any results, so they give up. So when they combine the exercise, diet, and optimizing their hormones and vitamin, they start seeing results, which actually motivates them for long term. Because weight loss, muscle gain is not like 1 month, 2 months thing. It's a lifestyle change. It's a long, right? And it has to be done with the combination of everything. It's not a one thing, or I have a magic pill that's going to fix everything.
Right. And but I'm pretty sure that you receive this question a lot when people go to you and say, well, how long is it going to take for me to see some results? And I'm not sure if you have a good answer for that, right? I'd say that someone comes to you with to do this vitamin and amino acids and hormone treatment. Would you say 1 month to see some better improvement? Do you have any baseline?
Yeah, so I'll break that question down. So say, for example, if a patient comes in for strict weight loss, doing their lab, say if everything is okay, what I try to do is I give them a 2-month program. The reason I pick 2 months is because some patients start seeing results in 15 days, and some patients don't see results for, like, they just start seeing result at the end of the first month. So when it's 2 months, we will at least know that, okay, what's working or not. And when I give them 2 months, they know that they have to do this for 2 months. And within 2 months is a good time that we'll know what type of result they're going to see with this therapy. And then we can adjust accordingly, right?
Yeah.
So to answer that weight loss question, anywhere from 15 days to 30 days, right? For the initial ones. And then if I see patient for testosterone, if they come in for sexual problems, like if their sex life is not good, then I would say I've seen anywhere from 3 weeks to 6 weeks. Strength-wise, they start seeing results right away. Like initially, like first 2 weeks, they see the result. Especially if the patients are weightlifter or somebody, then they'll see the results right away. At least 1 to 2 weeks, some result. Their strength improves. And then overall wellness is something long-term, 3 to 4 months they start doing. With the IV therapy, it's the immediate thing to feel fresh, because even without vitamins and everything, you're still getting hydrated. You get like 500 ml back straight up IV. So that's like you're drinking gallons of water. So you hydrate, so you feel that right away. But everything else is like 15 days to 2 months.
Now, and I'm pretty sure that probably this is a common question, which is, when you sign up for this, when you start doing this treatment, is this something that you're going to become dependent on for like the rest of your life? Or there will be a time that will be say, well, you are good to go on your own?
Yes. So even same thing. So if the patient is coming in for weight loss, then weight loss is something that's not long-term. You only do it for short-term. Once you achieve your goal, then I transition them to lifestyle, which is not, they don't get dependent on it. Now, if we are talking about testosterone, then if the patient is really low on testosterone, we start them on TRT, then they can be on it for long term because they're not producing. So it's not only for muscle building, not only for sex, it's for overall wellness too. Their concentration improves everything. So if the issue is a hormone issue, they'll be on it. Now, to answer the other question about the addiction, it's not addictive. It's not like addictive medication, but your hormones are low and you're optimizing. So you'll be taking, if you don't take it, it will go back to where it was. So you'll start feeling the similar symptoms that you had.
So,
but it's
yeah,
not
no,
like
I understand. It was not more on this on the mention of the addiction. It's more like on the dependency, right? Because at least for the vitamins, for example, can I transition from the IV vitamins back to the over-the-counter vitamins and to maintain? Is that possible?
Yes. So the idea is, even when you do the IV, right? I do recommend you still take a good multivitamin.
Okay.
Because multivitamin will have more stuff in it than just the IV. So it's not replacing one other. But with the IV therapy, it's if you are doing it for once a month, then it's gonna tailor more towards your goal. If you have trouble sleeping, anxiety issue, headaches, stuff like that, I give them little bit higher dose of magnesium, right? They can still take the oral magnesium. Now, when they take oral, it's not the amount that you can take orally, it's not as high as what you can get IV, plus the absorption.
Yeah.
So yes, to answer your question, you can transition to oral, and even when you do IV, you should still take a good multivitamin.
Awesome. Do you have any advice or treatment for also like joint pain? Let's say someone comes to you and say, hey, I have some arthritis and I have a lot of joint pain. There is anything that you can help me with?
Yes. So this is very common, especially for
weightlifters.
Not. Yes, you're right. So there's multiple things we can do. I do like if it's just one joint, like shoulder, knee, stuff like that, we do stem cell. I also do PRP for that, and a steroid injection, which is a quick fix, right? Now, overall joint, then if your labs are okay, we also give low dose of anabolics, for joint, right? But that has to be really monitored closely, and we have to get the labs done periodically. But if it's just one joint, stem cell, PRP, local injection can
What
help.
what is it? What is the
And
difference between the stem cell and the PRP? I thought they were kind of similar.
no, so the PRP is your own blood, right? We take your blood, spin it, purify it, and take the plasma out of your blood and inject it back, which improves it improves the healing.
Yeah.
It increases the healing part. It's your own body's.
And that's the one that hurts a lot, right? I heard.
We mix it with anesthetics, so it's not as painful. Because if you were to do straight up, like PRP can be used for hair loss. So if your hair's thinning, we do the PRP for
Really? But where?
in
Really? I
so
didn't know that.
so it's basically your own body's plasma that we use and inject it back, and it increases your healing power basically. So say for example, if we do it in the joint, it improves it reduces the inflammation and help you with that. When we do it in hair, so for example, for hair, if you're completely bald, then it's not going to help. But if your hair is thin, if you have a small like patches and stuff, then it will help you with that. It helps you regrow your hair, and the most important thing it does is it strengthens your existing hair, so you don't have a lot of hair fall.
That's very interesting.
Because
and then the stem cell is what is the difference you said?
the stem cell is something that's coming from umbilical cord. It's not your own. So it came from umbilical cord. The pharmaceutical purifies it, clears it, where it can be injected back in somebody else's body. So it's not your own form. It's coming from umbilical cord of newborn. Right.
And as far as effectiveness of one versus the other, is it similar? Which one is more effective?
The stem cell is more effective, but PRP, we do it multiple. So the stem cell, you can do one or two because of the cost issue. Stem cell is very expensive. PRP is lower on the cost, so you do multiple of those.
So even if it's a joint pain, let's say elbow pain, right? Golf's elbow, like it's very common type of pain for people that lift. That would be probably one shot of PRP or maybe two.
Or if it's just very localized, you can even do steroid shot, which can take care of the inflammation. Because a lot of time, if nothing is broken, it's basically inflammation.
Yeah.
And especially if you are lifting, and if you lift it wrong way one day, the joint will start hurting, right? And that's very common. So even the simple steroid shot can fix it. Not fix it, cure it, but at least help your symptoms.
The PRP, because you said something interesting, it doesn't really fix, only remove the symptom. So is it possible that over time it will come back?
So inflammation, like say for example, if you have an elbow pain and if nothing is broken, the symptom only because of the inflammation.
Yeah.
There's nothing broken to fix. So that's why it's mostly symptom control. Right? When we do steroid injection, it lowers the inflammation. When you do the PRP, the tendon that is inflamed, it helps that tendon to heal properly. Same thing with stem cell, because the tendon is not broken. If it's broken, then surgery, right?
Yeah.
But if it's not broken, there's nothing to fix there. So basically, it's more of the symptom control.
Excellent. Now let's change a little bit and talk about MyFitMed. How did you start this company and how it evolved to what it is today?
So when I after graduated at PA school, I worked for pain management clinic for a long time, and I still do injections there. But and at the same time, I was also working at the testosterone clinic. That time I saw a lot of patients, their testosterone levels were really high and they were still tired, right? As a man, a lot of us think that testosterone is the only, it's marketed good, so that's the only answer for fatigue, but that's not true. I have seen so many patients that their numbers are very high and they're still tired. So then I started looking into more functional medicine, did a lot of continued education, learned a lot about functional medicine, shared a lot of doctors in different states. And then I saw that there's a lot of other issue that has to be fixed. It's like four wheels in the car. If two wheels are going fast and other two are dragging, your car won't go as fast. I
Hmm.
opened my FitMed, where we are not a regular testosterone clinic. I do complete wellness. So when you enter our clinic, if you are somebody who is athlete, and I don't say professional athlete, but if you are somebody who works out, you are technically an athlete, right?
Hmm.
I improve your hormones, improve your vitamins, if you have joint pain and stuff like that, we fix that. All the common problems that an athlete can have, we fix that. Right? That's how I started, because I started looking when I was working at the testosterone clinic. I started looking at different clinics to see if somebody's doing this, and a lot of people were doing a lot of stuff, but there was nobody who was doing everything. So that's how we came up with this and opened this. The Frisco is our second location, and I we treat a lot of marathon runner, MMA fighter, power lifter.
And how long you have My Fitness Mat,
Uh,
My Fit Mat?
4 years.
4 years. And the
Frisco
Frisco
location we
the
opened
Frisco one
last,
last year, right?
yeah, last year. The Dallas one we had it for about 3.5 years.
Did COVID somehow impact your business or not really?
A little bit, yeah. We were doing a lot of telemedicine, but still we were seeing patients like they were not symptomatic, they need something. Um, they were coming in. It did affect a little bit, but it's picking up now.
Yeah, that's very interesting. And when you look at this entire package, and you start working on those symptoms to improve. You said you usually give a 2 months program. How is the follow up? Let's say I'm following the program, I'm feeling good. Is a follow up once a month, once every 2 months? I mean, let's say that you gave. I'm already on that point that I feel good. I just want to like turn on the cruise control and keep it on, right? So is that like a 2 months follow up? How do you work on that?
So this is the other thing to answer the your previous question is when I started this, I was seeing a lot of patients, they were having trouble with, we are not a regular medical clinic. The trouble they had was seeing a doctor, right?
Mm-hmm.
If they have a primary care doctor, they need some medication or want to address something, they physically have to go in to discuss everything. When I started this, almost all my patient has my direct number and they call me. So the 2 months program, they come in once a week. They can come in twice a week, 3 times a week, anytime I'm available. And if they can't come in, they can call us anytime. Because, and the reason we did this way is I don't want them to fall off the program, right? A lot of time they have a simple question. They start Googling if they can get hold of the provider.
Mm-hmm.
So if they have the access to provider, they can call me directly. So which I can address that question and they don't fall off the program, right? So I usually follow up if everything is going good, they don't follow up. I call them, try to call them once a month at least to make sure everything is okay. But they do it. Most all my patient has my direct number that they can always reach out to me if they have any questions.
And for people that are a little bit skeptical to do on-site visits, they can do telemedicine. You said that you're still doing that, right?
Yes, they can do telemedicine too.
And how the blood work? Do you get the blood work there, or do you have to do in another place and send to you?
So I order it at the lab. We use Quest, LabCorp, and CPL lab.
Mm-hmm.
So I can order it to because they have multiple locations. So we can order it to close to your work or where they live. So it's easier for them to just go ahead and give blood, because I want uh, the labs to be done early morning fasting. So if they are working or they have time issues, then they can just stop by at the lab, give blood, and I get the result electronically.
Awesome. That's great. Great idea because, as you said, people were doing like very unique things in different areas, but no one was actually looking to the entire package. And you brought this very unique offer to the market.
Yes. So the most important thing, the reason all our patients like coming in and like us is because the easy access. I'm we are changing the trend of the regular medical practice where people are skeptical about talking in detail with their provider. A lot of patients don't talk about their sexual side, their personal side, right? We make it transparent where they don't even feel like they're going to see a doctor or provider. A lot of my patients think they're my friend, and that's why they are honest with me. It makes my life easy for treating them, right? If I know everything in detail, if they have some stress at work, at home, anything, that may cause weight gain too, because that increases their cortisol. They're not sleeping good. All those stuff affects their performance.
Yeah.
So if they are comfortable, they'll open up, and we make it really accessible where patients don't feel like they're actually going to a medical office and get an answer. So they open up with us, basically.
Yes. Yeah. Well, Jay, thank you very much for your time. It was a great insight that you provide, all the details. And what is the website if people want to visit the website?
Yeah, so it's myfitmed.com, myfitmed.com.
And if they want to schedule online, they can just schedule online as well?
They can go ahead and schedule online, and we are running a special with Hidden Gym where they can mention Hidden Gym, or if they are a member at Hidden Gym, they'll get a $50 discount towards the lab, IV, or any other cash services we have.
Awesome. All right, Jay, thank you very much. Thank you, everyone, for listening to another episode of Unleash Podcast. Stay tuned. We have much more coming. See you next time.